Hi, I work here in the operating room at My Houston Surgeons. If you have been instructed to watch this video, it is because your scheduled surgery is set to take place here within the walls of our cosmetic OR. We wanted to cue you in on some specifics so that you can have a more smooth overall surgical experience with us. If you have not already done so, you will have a pre-operative appointment with our clinic staff prior to your surgery. They will review a list of do's and don'ts starting 2 weeks prior to your surgery. In addition to these recommendations, here are some other things to be thinking about when planning for the day of your surgery and a few days after. Please do not wear any metal or jewelry on your body on the day of surgery. This includes things like rings, watches, earrings, metal hair extensions, or piercings of any kind. This does not include permanent retainers or pins and screws from an orthopedic surgery that may be implanted in your body. You will, however, need to remove the very popular or no clasp metal bracelets. A plastic spacer can be placed into the location of a previous piercing so that it does not close up if you're worried about that. Unless the surgery patient is a minor, we do not allow loved ones to accompany the patient back into the pre-op area for safety reasons. Please plan in advance and arrange for your driver to take you home on the day of your surgery. This responsible, able-bodied individual should be at least 18 years or older, and they should plan to be with you for at least the first 24 hours in case you need assistance. Ideally, they would have a low-lying car to drive you home instead of a high-lifted truck. For our older patients undergoing longer surgeries, you may require an additional person to help you or even request a wheelchair on standby at your home, hotel, or Airbnb. The persons taking you home does not need to remain on site for the duration of your surgery, but they do need to be reachable by phone when it's time for your pickup. Upon arrival on the day of your surgery, we will get your ride's name, their number, and their relation to you, and how much of a heads up they will need in order to make their way to our office. Our staff will then coordinate with this person based on this information. It may be a good idea to prep your loved one picking you up from surgery in regards to your anticipated change in appearance, as well as your condition. Tell them you will be groggy, bobble-headed, and may take several naps during the day for the first 24 hours. It may appear as if you are not ready to be discharged from the facility, but rest assured, if you are being discharged from our facility, you have met certain standardized safety criteria and your discharge has been approved by your doctor. It is also totally normal to feel tired or in an anesthesia fog, even the day after your surgery. Our OR staff will call you to check in on you the day after your surgery, so be on the lookout for our call. If your provider has called in any prescriptions for you to begin taking after surgery, please do not wait until the day of your surgery to pick them up, as some medications may be out of stock, unavailable, or require prior authorization. We highly recommend that you go pick up your medications several days before surgery and match them up with the pill bottles with the list of the medications that should have been sent to ensure you have everything you need for surgery. As a reminder, we have clinicians on call 24 hours a day, 7 days a week, and our clinical staff has an assigned person to Clara during normal business hours for your convenience. Thank you for listening, and we look forward to taking care of you soon.